Paul here, and this is how he presented. So he owns a garage, a petrol station, a gas station near to Garstang, and he has been treated by a really good dentist who's retired, a really good general practitioner based in Garstang, and a very competent, good quality general practitioner. And he's got complete upper and lower dentures here, implant supported. And he just felt that his lower denture wasn't connecting to two implants at the bottom. He also wanted a more natural smile. He was just saying he wanted these areas filling the buccal corridors and just a different arrangement, not quite as sort of together and straight. He's a nice guy. And it was when I was filling my car up, he said, Finley, you've got to have a practice, don't you, in Garstang? My dentist is retired. Could you help me? So, and I noticed that the occlusal plane here was dipping down like that at the back, straight away. And also there's quite a bit of gum showing up here, which it's not really a great look either. So this is in his mouth. Reasonable quality dentures. I just want to just bring these out buccally there a little bit. He's been wearing these for about 10 years. And we do find that patients who've got implant supported dentures, they do wear more than a just normal conventional complete dentures that are sitting on nothing. So the wear is increased. And as a result, sometimes teeth do snap off and break. There's increased breakages, these types of things. So these were his concerns at presentation. The lower denture was just not fitting onto the implant attachments. He wasn't totally happy with the appearance, and he wanted a more natural looking denture. But he didn't really have specifics about that, so we had to really drill into that in detail. So I'll talk about that in a minute. So his wishes, and I think this is really important, what can we do with these wishes, and can I address all of these? So he wanted a more natural looking smile. Yes. Dentures that didn't look false. Yeah, we can definitely do that. Better fit and function of the lower overdenture. Possibly. Improve comfort when eating. Possibly. So just have a little look here. That's the upper in the mouth, the existing worn occlusal surfaces. Generally relatively well made, but what I do see often with most of the time with lowers, they're just underextended in this area here. I like them to cover right over the retromolar pad. That's something I really look for. The rest of them are quite nicely bordered, molded, quite nicely made dentures. Even with implant supported overdentures, I think it's really critical to not throw away our prosthodontic principles, but to make them correctly extended so that we get maximum stability from the denture bearing area, as well as getting retention from the implants too. So just as normal, please everyone, if you do have any questions during this whole webinar, please just pop them into the chat and I will answer those. There's a chat box or Q&A section just there. So the extensions aren't like fantastic. This one here to get a better suction, it's underextended in this area here. This can be in that position though if the patient's got a pronounced gag reflex. So I'd have to look at that when I come to do my particularly the registration appointment when I've got the wax blocks in place. And again, suboptimal extension retromolar pads. Let's look inside here. So Paul has got the Straumann retentive anchors. So it's a stud that goes into the implants, and then inside the denture itself, the attachment in that there's a little gold clip which can be adjusted. And I can see that these have been cold cured in place by his dentist that has now retired. That's them in the mouth there. So we've got, these are the studs, and these implants are Straumann, so they're tissue level, so they're just coming up through the surface here, and then these studs just screw on the top, just there. A little bit of calculus around them there. Quite often see that with these sorts of patients. And that this is the upper, his upper ridge is not too bad, a little bit shallow sulcus, but quite a decent sort of width and size there for getting a denture to have reasonable suction. You can see quite a prominent frenum there. That can just disrupt the suction effect too. Let's have a look at the lower. Got quite a narrow lower ridge. These are the implants in there, nicely positioned in about the canine regions. So I like to just plan everything up and just go through the whole process. So I treated Paul about 2 years ago now. He was happy for me to show you this treatment planning card, which shows the fee total. So he paid just over 11,000 for what I was going to do, which is to make new upper and lower metal-based dentures and replace those studs with locator attachments, because I love locators, use them for years, really straightforward to use. And then also in the existing old denture, I wanted to make those serviceable too. So to put in locator attachments into the old dentures, so he has a spare set. I think spares are super important. This is the treatment planning letter and consent form that I sent through. And then Paul, if he's happy with all of this proposed treatment, he signs that and then sends that back in. We do that via DocuSign now, electronic transfer. Just send it through, he signs it, and we get it back. It's really good. I've got copies of all of these treatment plan and consent letters on my website on the resources section. If you just click on there and scroll down, you'll find one specifically for implants overdentures. So great. I've got a question here by Toby Edwards Lunn. Hi, Tobe. Hope you are doing really well. What are my views on Novalock? I think Novalock are very good actually, Toby, but I do find, and they are identical in size and shape to a locator attachment. But what I don't like as much, and I don't think it's quite as forgiving, is the insert inside the denture. It's made of PEEK, and it's just more solid and rigid. And I don't like the way it clips onto the implant. So if I do have a patient who comes in with Novolocks, then I usually swap out the attachment with a locator because they both fit. Because locator, the patents ran out for them. I think it was maybe 20 years after it came on the market. So a lot of other companies just copied that shape now. So it's interchangeable, Toby. Great question. Keep those questions coming in because it really helps me to cater to exactly what you need to know, what you really want to know. So let's dive into visit one. So I've done my consultation. I'm now going to head on to getting on to making the new dentures. So I select my tray for my primary impressions. If you've heard me speak before, this is what I love. I love to use an injectable material up into the sulcus first, there, and then in the tray, stock tray, I use a more thick, heavier bodied alginate to do that. And this produces a beautiful impression right up into the sulcus. Lovely. Love it. Great. This is my lower one. Now, this is not as good as I normally like to get. It's absolutely perfect on the periphery here. But if you look on the lingual aspect, particularly in the this retromylohyoid area, not quite captured it as good. I prefer it if it looks like this. This is a patient with no implants at the front, but another one. This is actually June, who I've just made a complete dentures. But you can see I've got that really beautifully extended. However, if we look at the side there, I've still got the retromolar pad and I've still got a little bit of sulcus depth. This is the mylohyoid line. So it's still okay. It's still fine to produce a nice special tray on. But I do prefer it if it looks a bit more like that. But sometimes the patient's tongue just gets in the way a wee bit. Great. So next, treating patients who've had previous implants done. Any of you that do this, you know that we've got to have like a load of stock of screwdrivers and parts and bits and pieces to be able to undo these sorts of things. And in fact, for this chap here, I had to borrow the driver set from the dentist who'd retired from their practice, which is just round the corner in Garstang. So David kindly lent me this. So this is me, and I'm just taking off one of the studs here. So I'm using a torque wrench and just undoing that. And when I'm doing this, I'm always a little bit like nervous about this because I don't want the implant to undo in the bone and the implant to fail, because these have been in for quite a while, but it undid quite nicely. So once I've undone it, just loosely, I then take the torque wrench off and then I just unscrew the abutment there. So I just take that off like that. And then I can then do the other one and then put on some locator attachments. And these are the two locators. And I always choose the smallest, the lowest possible, which then gives Rowan the most amount of prosthetic space to put the metalwork and the acrylic work too. So these are locators ready for the Straumann. Locators produce tons of different sizes lots of different locators for different implant systems. I find that they're really very, very good. So Lucy, hi Lucy Doherty. Would you typically modify the tray for primary imps like with green stick? Lucy, no, I don't. I don't modify my stock trays with green stick, but because I've injected into the sulcus with the injectable material, and that captures the depth of the sulcus, so I'm quite happy with that. But I do modify the special tray, Lucy. So thank you. So I've put those on, and now what I want to do is I don't want to have to keep taking the studs on and off at each visit. So I'm going to, what I did was I just drilled out the old attachments from his existing denture. And if any of you are doing this today, if you're doing this like a pickup impression today or tomorrow, like this, and a pickup of the housings in the denture, a cold cure, fitting of the housings, it's imperative to use these little neoprene PTFE washers. They're not neoprene, PTFE washers that go over the top and block out any undercuts. Ultra, ultra important. Because if I don't do that, it can get stuck in. Next thing I do is make sure that the housings have been sandblasted there. So these are the bits that are going to go into the denture that will fit onto the locators. So they get sandblasted, and you can I use a Rondaflex, which is just I fit it onto the unit. They're nicely sandblast. So I push those onto the locators there. And then the next thing that's super important, I want to make sure that the denture here fits over that locator both of these passively. So it sits over that without riding on these attachments and sits beautifully onto the soft tissues. So I use occlude spray, arty spray, occlu spray. It's a powder spray you can get from Henry Shine or any big distributor. Spray that on, take that to the mouth, gently fit it over and push it down. And I want to make sure that it's just fitting passively and just checking with my fingers that it's just sitting onto the gums really nicely, onto the supporting ridges, and also the bite's correct. And I could just feel that it was lovely and passive. And when I took it out, I could see that it's not touching those housings. You know, if it was touching those housings, then what I'd be doing is drilling away the powder, but it didn't, so it was nice. So I need to clean that off. I just use a toothbrush with some liquid soap, fairy liquid, and then use a pressure steam cleaner, and then finally sandblast it. That'll take everything off. Intraoral sandblaster. So it's super clean, ready to go. I've also what I've done is I've ensured that I've got a nice undercut here and here for the locator housings. So hi Danny. So there's a question here. She understand the whole attachment and locator principles, just don't know where to start in choosing them. So many out there and often not compatible. Any guidance there? So Danny, I keep things really like you were sort of talking about. I've got a very simple brain and I don't like lots of complications and things. So whenever I have a new patient that's maybe got studs, oops, and old attachments, then what I do is I swap them out for locators. So I just go for this standard approach of locator. Like Toby was talking about, Nova Lock are just the same size as well. So you can put Nova Lock in too. They're just exactly the same as locators. But I just love those. Keep it super simple. There's lots of different implant systems like Straumann and Astra and um, Noble Biocare and Bio Horizons, tons of implants, Southern implants, but the locator company will produce an attachment that will screw into any of those commonly available makes. Great. Let's go back to fitting this in. So I'm wanting to put the housings into the denture here. Now, the other thing that I did here, which I think is really important as well, I'm just using a little bit of Vaseline on those PTFE washers too. I just do not want the acrylic to grip those and it to just remain in place and me not be able to get it out because it really is a little bit squeaky bum time doing this. And then I squirt in my cold cure resin. I really like Eufy Gel Hard C. Love it. I don't use any metal primer on the attachments, but I have used the adhesive in here. I think that's super important. I've used the adhesive on the fitting surface that comes with this kit. I just follow the instructions of that. So I'm not using too much either. Super important. Let's take this to the mouth. It's critical that they're just dry. Those attachments in the mouth are dry. So Claire's been aspirating whilst I'm doing that. I just press it down. Can you see there's a little bit just squidged out of a hole? There's a little venting hole. I don't need venting holes, but sometimes it was just a little hole that was there. And then I get it to sit nicely, gently close together, and then just wait for it to set. Super important is this. And I leave it for 10 minutes, a good 10 minutes. until it's fully set. And then I take it out. And I'm always a little bit nervous about doing this because sometimes they can be really quite hard to get out. So I always warn the patient. I'll say to Paul, right, I'm just going to take this out and it might need a bit of a tug. And it's always a nice relief to get them out. So that's it. It's come out nicely. And then I just clean those up. So take off the little washers. And these are the black processing caps that are inside. And then I swap it out. And because these implants are quite nice and parallel, his dentist has put them in nicely. I used this one here. This is the weakest of the attachments to use with parallel implants. So these have a grip of 500 grams each. That's 1 kilogram, that's 1.5 kilos. And this is a little tool that helps you can just push these in. So that's got the blue attachments in, using the weakest possible, and that worked beautifully. So great. Toby, hi. You don't need venting holes. I'm putting them in. Am I wrong? No, Toby, I don't use them. I don't use venting holes when I'm doing this cold cure. What I really importantly, what I'm thinking about whilst I'm doing this is not to use too much acrylic because I don't want it to wash all onto the fitting surface. The reason I don't use venting holes is that quite often Rowans put metalwork over the top inside the denture itself. And so drilling a venting hole is quite difficult. And I just don't find they're necessary. And they also mess up the polished surface a little bit. So, but there's loads of ways of skinning a cat. So, hi, Eugenia. Good morning. Hi, everyone. This is Eugenia. So, please, what do you mean by saying the old denture is overextended, yet you recommend covering the rectum with pads? So, Eugenia, I think I must have accidentally said the word overextended. You're absolutely right. I meant underextended. They're too short. So that's sorry about that. Anyway, let's go back to this. This is really important. This next little thing is I have found swapping out this sometimes if the existing denture is not very good, it was pretty good in this case, but sometimes if the old denture is not very good on the implants, it can actually make the denture uncomfortable if the old one was a bit slack. So it's just a word of warning, because I have done it in a case where the denture wasn't great, we swapped it out, and it was constantly uncomfortable, and it really was a bit of a pain. Also, what's super important, and this is one of my colleagues, he got this wedged in, totally stuck in. This is one on four, and he was cold curing all four together, and it got stuck totally on the front two implants. And so this is a new denture that had been made with metal reinforcement, and he had to drill it out, and it took ages. The patient had to go away for a day or so with this stuck in the mouth and then come back when he had time to be able to drill through it. So it's a problem. So it's really important to put those little neoprene, those PTFE washers. That's great. Joanne Yim, great explanation. Can we use the black cap instead of the black color cap if already retentive enough? Thanks. So, Joanne, good question. The black ones are purely for cold curing them in or fitting them in the lab. They're not for long-term wear from the patient. You can use them for maybe a week or so in the mouth, but I recommend just swapping out to the proper ones. These are for cold curing or lab attachments. Great question. Joanne, if the locator abutments are already worn off, is it possible to change a new nylon insert only, or is it necessary to change the abutment? So, if the old abutments, if the locator abutments have been in for quite a number of years, then swapping, they can get quite worn. So just swapping them for new ones quite often makes it amazingly fantastic. But sometimes just putting a new attachment in that's grippier can help. So, Danny Colbert, can you repeat the attachment placement again? So at placement over Locator, you haven't got your permanent attachment. Is the blue capping just a replacement portion that loosens up over time? Danny, I'm going to show you how I cold cured it in later. So I'll come back to that in a minute. Let's go for it. Working impressions. Visit 2. So he's gone away with his old dentures with the new attachments. I'm not going to do my working impressions. So I've got my custom trays. I've got my wax rims here for the primary dual registration. And these are my primary casts. So let's do the upper working impression. So that's it there in place. I've bored and molded it really nicely with green stick. I wanted to pull the cheeks and waggle the jaw. So he's doing all of the movements he's going to do in his everyday life. I then put adhesive on all over it, dry it off with air, and then put my water glazed alginate in there, pop it in, and then do all of my movements, pulling, waggling the jaw, opening wide, like that, just like this. And it looks great. So that's beautiful impression, upper. Lower impression here. So I've got my locator attachments there with pickups on. You know, these little wine goblets. They're like upturned wine glasses. Down. And I'm going to use Imprigum on my lower impression. So I've got my special tray, and I love using the Dr. Giro Arbe lower extension, which covers the retromolar pad. So Eugenia, this is where I'm going to be taking it further up on those retromolar pads like that. So there, so I add green stick to the lingual surface and the buccal shelves, and I do all these different movements with that soft, holding it in place. E and oo, lick the lip, push the tongue against this lower strut, and have a powerful swallow. So I'll show you exactly that just now. So I load up my tray with Imprigum. I've put my adhesive on. Let's go for it. So I just squirt the Imprigum around those impression pickups like that, and then take it to the mouth, the impression tray, rotate that in, and I'm going to do those 5 movements. Look at me seating it, it's lovely. This is so important for a great, beautifully extended denture. So it's ooh, ee, ooh, and I join in with the patient, stick the tongue out, right out, side to side, push against the strut, get that tip of the tongue against the lower front teeth, there, pushing. And then Claire squirts in some water, a nice powerful swallow. So the whole of that periphery is beautifully border molded. Patrick, I've seen your question, I'll come to it. Can you see how that's beautifully border molded? It's like a lovely polished surface there. So Patrick has said, how warm is the impression compound when you take it to the mouth? It's just over 60 degrees Celsius. So it softens at 60. So it'll be around about 70 degrees Celsius. So it's a bit hot for putting my hand in the hot water, but it's absolutely fine for the mouth. You know, it's like a cool cup of tea in the mouth. Toby, hi. Finn, how do you warm and place a green stick? Sorry, I'm coming on your course in October, but wanted to see if once on the tray, do you pop the heat bath or burner again before inserting? So yeah, I've got loads of videos on YouTube showing me how I do this specifically. But I'll just talk you through it. I run hot water into a kidney dish just from the tap, and it's about 70 degrees C. In that is green stick. It softens it. I have my tray and I flame the edge of it so it's hot. And then I get the green stick and stick it onto the side of the tray, and it sticks on the tray because the tray is hot, and then put it back into the hot water so it's lovely and soft, and then I take it to the mouth, and then I can mold it. It's dead easy, super simple. So this is my impression. Um, Now I'm not worried about tray showing through on these ridges, but one thing I think is really important, which with taking all of these photographs, I take a photo and it just goes into the patient's records. If when I come to fit it, these areas here where the tray's showing through, or there, for instance, hurts, I know I might need to adjust it there. So that's quite important. Secondly, can you see I've got my pickups really well fitting there? It's so important that I wait for the imprint gun to set fully. So I have a stopwatch and then can make sure that I've take it out when it's set. I don't like leaving it. I don't like taking it out and then these staying on the abutments. So it's so important to use that stopwatch. Also, at this visit too, I do a really fast jaw registration. Now, this is not for setting the teeth up, but it's purely to allow Rowan to relate these working casts so that I can then get a Gothic arch tracer, otherwise known as a central bearing apparatus, set up. So Rowan mounts both of these working casts like that, using that primary jaw edge. And then he sets up the Gothic arch tracer, which I love because I can find centric relation perfectly with this device and get the bite just right. So let's fast forward to visit 3. So I'm going to do the registration here. So I've got 2 lots. I've got a rim with a lower block there, and I've got my central bearing apparatus, which is set up on it's a Gothic arch tracer ready to record CR. So I'm going to use this thing first, the upper rim and the Manchester block. And I'm going to use the Clark Gable photograph here to as a guide. So, and I carve it in this set order. I do my lip support first, and then incisal plane, occlusal plane parallel to the alar tragus, trim my buccal corridors, and do the centerline and OVD. And I used a photograph of Clark Gable in this instance, but because it's so funny, this is the only dentate picture he had. And he's about 7 there, so 7 or 8. And you can see he's got a bit of a diastema that may have closed up as he got older, I don't know. But that's his only dentate picture. And I just thought, and Paul was really happy about this. I just remember Clark Gable from when I was a little kid on TV, and these black and white movies, and he had this is his arrangement of teeth. And I remember at dental school we did learn a little bit about him. There's a guy called Charles Pincus who was a dentist in California who did veneers, one of the sort of pioneers of doing veneers. Years and years and years ago, he did these ceramic veneers for Clark Gable. So, and I thought, Paul, you just look so similar. So let's use you as a guide. So I trimmed that rim according to Clark Gable smile. And then next we've got I use a bite fork here on that carved rim. So that means that I can mount that. So Rowan can mount that using, beautifully on the articulator. So at this visit, what I do is I pop on the trimmed rims onto the articulator, and then I can set the vertical of my Gothic arch central bearing apparatus. So I've got this set now at the right vertical I'm going to restore and pull. So I'm going to pop this in. Now this is a little bit of a different Gothic arch tracer that I've got a few in the practice. This is a blue dolphin one, and it's an American product. It's got a ball bearing on here that touches that plate. Goes in the mouth, and then I get him to move. Watch this. He's going to go all over the place. Forwards. This is what I say to him. Go forwards and back. Forwards and back, side to side. And then I want you to go all over. Really go for it. Try and colour in. And he did a fabulous colouring in. This is before he did it, and this is after. Can you see how? So I absolutely love it. It's like an arrow pointing precisely to CR. There, that's where the bite's going to be. So what I do now is I take a plastic disc and I position that plastic disc right over the center of the arrowhead so that the hole there in the disc is right over the middle of that point. And then I fix that together with some wax. Take that to the mouth and then guide the patient into that hole. So the lower goes into the ball bearing goes into that hole. It's totally locked in CR now. It's flipping great. And then fixes it together like that. So that's what goes through to Rowan afterwards. So I've got my trimmed rims, Clark Gable style. I've done my Gothic arch tracer. So this is the exact CR position, and I've also done my face bow on that. So the working cast then get mounted with all of this material so that Rowan's got Paul's head on the bench looking at him correctly orientated in the articulator like this. So Rowan gets these photos. He gets Clark Gable's photo, he gets Paul's photo, and then arranges the teeth accordingly. It's really nice. So this is a wax base with a shellac reinforcement. So I'm going to try this in the mouth. We've got space ready there. The teeth I really like using are these Shotlander Enigma Life teeth. They're a British product and look fantastic. I love them. So let's try those in. And Paul, Rowan's recreated Paul's, a little bit of a diastema there, and he loved it. Can you see how we've just dropped the occlusal plane is really nice. There's no gum work showing at the top there. It's just a bit more of a natural looking set. It looks maybe a little bit too regular, but he loved it. So I just go with what the patient really wants. I think that's so important. We did a video just to check he was happy with that. Next, we go ahead and process these, and like this is so important. This bit here is reinforcing the dentures. Now this is the flask in which Rowan's going to process the upper. This is the flask Rowan's going to process the lower. Now there's a metal piece here which is made of chrome, and that's then opaqued in pink opaquer just so it masks the color. But that metal works really solid, really rigid. It's got a metal bar running across the top. It's totally solid. And then the lower here, it's got metal running over the top of where the housings are for strength. Super important. So Rowan processes these dentures. So that's the upper with the metal insert in there. And I think it's so important with metal reinforcement is to allow relining if necessary. So an acrylic post dam is really important. And it also, I find that acrylic post dams are really important for suction too, because sometimes I have tried bringing the metalwork right the way back and having a post dam in metal, and it just doesn't have as good suction, I find. This is lower metal reinforced denture. It's got that chrome work encased inside it. Really important because the patients, when they can chew and eat with these things, they can break them. I think that's super important. Can you see Rowan's also processed in the attachments, everyone, here? So if you're still listening, Danny, this is what Rowan did for me here. He processed the attachments in, so I didn't need to do it when I came to fit it. So that's fine. So I'm just looking at the Q&A section, just checking that there's no further answers. Tobe's had to go and treat his patients. So bye, Tobe. Have a good day. This is all recorded, by the way. I'm going to be putting this on YouTube later today. So that's the finished denture. We've got A2 teeth, a little bit light, really, but look at how the canines are naturally just a little bit darker using these Enigma Life teeth. These are Vita shades. Beautiful. And that just shows you the weight of these dentures. 28 that's got that metal reinforcement. If that was not metal reinforced, it would be around about 17 to 18 grams approximately. This is the metal reinforced lower. I quite like heavy lowers because the gravity's helping it, but I don't really want super heavy uppers. But 28 is not too bad. Anything over 30 is can be a bit problematic. So quick question from New Zealand. Hi there. Gayathri. Great to hear from you, Gayathri. Might be a silly question, but in terms of longevity, which is better? All on four, all on four slash all on six versus overdentures like the one you described. No, it's not a silly question. I think from a predictability point of view, Gayathri, the overdentures are easier because as it wears, it can be replaced quite straightforwardly. Replacing a fixed restoration is more of a faff. If they're made of the same materials, the all on four slash all on six will wear down quicker because it's more rigid, though. So I do think the more complicated you go, and this is from my experience, the more complex the restorations are, the more maintenance is required. So complete dentures are super simple, less wear, less need to change because they move around so the patient can't really chew as much. But as soon as you've got implants in, more wear, fixed restorations, even more wear. And then when you go to zirconia and porcelain, the wear is less, but then you get fracturing of stuff, which can be an issue. Jonah Thorpe, dental student here. The patient originally had a very worn occlusal plane. Would you try and replicate this at all for patient comfort and acclimatization? Jonah, you are ahead of the game here. I'm going to come to that in a minute. You're right. Super good question, that. So I'm going to come to it though. Denture fit delivery. So let's fit them. So like you said, Jonah, this is dentures fitting, and what I do, I think this is really important, the fit appointment. I don't attach them to the locators first. I do have the metal housings inside the lower denture, but they don't fit onto the implants. I want to make sure they're comfortable without that. They're not hurting, and that the bite's good too. Jan, hi Finn, greetings from Sydney. Can you describe the upper metal plate design, please? So Jan, I'll just quickly go back to it, just quickly there. That's it here. That's the metal design. It's got metal on the fitting surface, Jan. So the metal will be, you'll be able to see that through the denture here, like that. But on the polished surface, the acrylic bonds to it, and we've got these little bubble and beads on there. So the acrylic work covers the acrylic there. And I do find this quite nice because it means I've got no metal junction there, and it can be quite good for patient speech. So super important. Jan, also just out of interest, my next newsletter, I'm not going to do a case. I'm going to talk about metal reinforcements and explain pros and cons of different metals designs and what I think about it. That's what I want to do next time because breaking dentures are a problem. If patients are spending a lot of money, they hate it when they break. Let's go back to the fit. Right, so once I'm happy that the whole thing's fitting, I'll then fit in my locator attachment. So for this, I used the blue, again, the weakest attachment, just there and there. And Danny, I've not forgotten about your little question about going through the cold cure bit in a minute because I'll show you that just in a sec. So this is it here. But this is for Jonah. You know, you've talked about, and it's a great question, is they've got very worn occlusal surface on the old one. They've got new teeth on this one. They've got beautiful cusps, and they're going to be really interdigitating. So this is what I do. I use a grit here and mix it with some toothpaste and put it onto the teeth there like that. So it's mixed with, and get the patient to grind around and mill it in themselves. So this is them doing that. And what I encourage Paul to do whilst he's doing this is like, can you really work at areas where you feel that the dentures are locked? If they're locking, just try and grind that area. So I just encourage them, and because these Enigma Life teeth are made of composite, the back ones, they're hard. They're quite wear resistant. This does take quite a while. Sometimes it's like 10 minutes or so, really going for it. So, Jonah, this is how I get around that issue. This is 600. So, this is the stuff here that I use. It's milling in grit, metal filings, just iron filings. So, he then went away. And he had various problems, and it's not uncommon for patients to have these sorts of problems. But he did have more complaints than normal. First of all, he said, "Look, Finn, these dentures, I'm getting food stuck on them, and the old ones didn't. They feel rough." This is quite an uncommon issue, actually. I don't always get this because I quite like texture, because texture's like it makes them look better, like normal gums. But anyway, that was one of his complaints. He said the upper feels a bit loose too, and it moves when I'm eating and chewing. It just loses its suction. And that can be, this is a problem too. Dental students and younger dentists, that if you don't do many implants, if you've not done many implants, if the lower is really rigid onto implants, it can disrupt the upper more occlusally and lose suction. So that's something there. And then also the lower denture pops off the attachments, it just comes off. It doesn't feel like it's fully down. So this is how I dealt with those complaints. So Joanne, I'm going to come to your question just in a minute about little points there. So anyway, this is addressing all of his complaints. So number one, all I did was really polish those dentures. So going from that textured finish there, and I I do a lot of prosthetic work, and I've got the lab next door, but I've got this little polishing lathe, which you'll see in dental schools and in labs there, and it's really dead cheap. And if you do a lot of prosthetics, I get one, but I can just really use a polishing rubber first, and then use pumice, and then use the polishing wheel to get them super smooth. Can you see that? Just gone really shiny. I've taken off all the texture off the teeth too. So super smooth. I have to do this in maybe about 2% of my cases. Now, in order to make the fit better, what I did was I did a reline impression. So I did a very, very thin wash impression in silicone on the fitting surface, doing all of my movements there. So Rowan relined it, and I do find that just doing that does help with the suction. It does. If there's any little problems, it just helps with that. Importantly, I do it very, very thin, and also Rowan cuts away any of the reline over the top, so he doesn't. He still allows this metalwork to fit against the gum, but all of this area, the outside bit, has been relined nicely. So, and then finally, and then Joanne Yim from Malaysia, and also Danny, you've been talking about picking up. I decided, and this sometimes happens if I've had it processed in the lab and the lower's not fitting properly, and all it takes is something slightly off for it not to fit, then all I do is I just drill them out, those housings like that, and I'll cold cure it in the mouth. So, Joanne, I'm going to look at your question now properly. So far, I've only used the chairside pickup technique, as I'm concerned about potential errors with the indirect pickup, either during the impression stage or due to discrepancies during denture processing. How can we address or prevent misfits when issuing the denture? So, Joanne, you're absolutely right. So, if I get it processed in the lab, I have to be aware that I might need to resort to this. So if it works with processing in the lab, it saves time for sure. And if I'm worried about getting it stuck on the implants, say if there's threads showing of the implant and there's something issue where it may grip, then I will get it processed in the lab. Or if I'm feeling a little bit lazy, like this, like in this case, but sadly, it came and bit me on the bum, so I needed to do it like this. Great. So I've drilled them out. Chun Chang, what would you do when you're trying the wax denture? So I'll come back to that in a minute, that question. So I've got this ready for processing, and I then put my washers on, which are critical, and then a little bit of Vaseline on the edge of those. I've got my sand blasted attachments that just fit on. I make sure the denture's fitting over that nicely and not touching. So can you see where it's just touching the top of the housing there, but it's not touching that one? I would drill that away and repeat it until it's just definitely sinking into the soft tissues a little bit. So can you see where I've just caught him a little bit there. There's just a little bit of bleeding on that flange. So I clean everything up, and then I do this very carefully, and this is super important following the instructions. I sandblast the fitting surface, and then I apply the UV gel adhesive into those fitting surfaces. And then I squirt in my UV gel hard, pop that in the mouth, wait for it to set for 10 minutes, and then take that out. And then I can then just clean up and tidy up those areas and then flick out those black housings. It's all nice and tidied up. And then I can then put in the locator attachments. And that worked beautifully. So this is this before and after, just there. So Thompson Kandori asked, "Hello, doctor. What is the green material you are using to check the fit of the locator?" That's called occlude, Thompson. So the spray is and I use loads of it because it's a really important product for checking the fit of dentures on hard tissues. So this is called occlude. There's another trade name called spray, arty spray, and another one called occlu spray. So, and then the next question, Chun Chang, what would you do when you're trying wax denture? I try the wax denture in and make sure the patient's totally happy with the look of it and also the feel. That's what I'm checking. It's the look and the feel using a video. Great. Let's go back. So these are the new ones. So look at the extra extension there, Eugenia. So that was short, longer. Better extension on the upper, better suction too. And it was fine. Once I got addressed those three issues, he was good to go. So less gum showing, at the side there, nicer arrangement of teeth parallel to the ala tragus. Super important. Clark Gable setup. That's great. Right, Eugenia. Does this mean you do not recommend trimming off the cusp to give the flat teeth effect? Absolutely. I believe it's better to keep the cusps. It helps to keep balanced articulation. Patrick Puckett, how did you drill out the housing of the new denture? I just got a burr around the edge and just took it out. But there are tools for doing it. I just trephined round it with a small round burr using a lab handpiece. So that's great. Anyway, that's 1 hour done. So I'm running the overdenture course next week on Thursday. We're sold out for that. I do it every year. And the other date is going to be a year from then. And I've got an immediate denture day as well on Friday. And I do have spaces on Friday for the immediates there. So if you're interested in coming along to that, I do have spaces next week for that. So these are my course dates for the remainder of the year. This runs right the way through to November there. So, and then interestingly now, all of my diary dates are ready for bookings for next year. So if you go to the website on the clinical courses, you can book yourself on any of those courses. So the implant day next year is Thursday, the 25th of June. And that does get booked up quite quickly. So I'm going to be talking over in the Netherlands later this year. We're doing a day with quite a number of other really brilliant British speakers. They're all talking about implants, and I'm talking about implants related to overdentures and also getting the teeth in the right place as well. If you're in America next year and you want to come and see me, I'll be speaking in Texas for a full day at this place, and Rowan's coming with me. That's another workshop. And Rowan will have a little workshop there too with loads of lab stuff to show. That'll be great. So the next Zoom study club I'm doing is Thursday, July 10th. Jan, will be specifically on metal reinforcement for dentures. There's one last question here, Joanne.